Private healthcare in Nigeria. Has this become like a game of Russian roulette? Do you know what a game of Russian roulette is all about? It is a very risky gamble. It's a foolish gamble that people do. You put one bullet into the cylinder of a pistol, you spin it, you put it to your head, and you pull the trigger. If you're lucky, you're alive to go through another round. You know, with every time you spin that cylinder, what happens? Your chances of remaining alive reduce. Is that what we're doing with healthcare in Nigeria? What do I mean? The fact that we cannot tell the difference between a chemist and a pharmacy. We cannot tell the difference between a hospital and a clinic. So therefore, so many Nigerians end up calling a chemist to get a medical diagnosis. And the chemist now becomes their doctor, who then prescribes to them what a pharmacist should have done. And in the end, they don't go to hospital. They still remain at the level of that chemist or pharmacist. What do you think they're playing with if it's not their lives? So how do we get better health services for the majority of Nigerians? Many who have been to big private hospitals know that, okay, you book an appointment, there's the admin process, then they take your vital statistics, then they assign you to a doctor recommends some tests, you come back for follow-ups, and so on. So what most people in that situation care about is the time it takes. Maybe if we were able to squeeze the time, they'll get better healthcare. For some others, getting better healthcare is about having staff in those hospitals who have better empathy, and you can feel much better already relating to them. But that is not the case for over 90% of Nigerians who do not have access to HMO. They cannot access good quality hospitals. So that scenario only accounts for like 10% at best of Nigerians. So what happens to the rest of Nigerians? In Lagos State, they were so concerned about this that they set up the Health Facility Monitoring and Accreditation Agency. But that is Lagos. It doesn't speak for the whole country. So there's still 35 states. Ogun State alone, like 2 years ago, had to close down 168 of such facilities which were not licensed because people are going to untrained people for their healthcare and also to unregistered facilities. And you think that it's only happening to the poor, so it doesn't affect me. You'll be amazed at how many rich people in Nigeria, rich quote and unquote, are affected by this. All of those who take elective surgeries, who go for a tummy tuck or some other kind of plastic surgery, they pay millions to these guys. Most of those facilities have no signboards. I know people who have died at the hands of such quacks, and it's on a regular basis that people are dying, but they are too embarrassed to speak out. It's about time that we start to speak out, not just for the rich, but for each and every Nigerian that is unable to get access to good quality healthcare. Now, good quality healthcare, therefore, begins not by certifying the private hospital saying, oh, meet the South African standard or meet some other global standard or even meet the new standard that was recently brought in this April in Nigeria. No, it doesn't start with that. It starts with something as simple as registration. How do I know that the facility I am entering is properly certified to provide the kind of care that I'm seeking? Is there any way I can tell? In Lagos, they say, oh, look for our logos. When you see our logos displayed at that facility, then you will know that they are accredited. But how do you know what they are accredited for? So if they are accredited as a place for maternity, does that give them the license to carry out kidney transplants? How do you know that you're not getting into the hands of quacks? We know logos can be faked, they can be copied, but what about QR codes? With the QR code directing you to the government website where you can see that particular facility and see what it has been licensed to do. But even that is not enough, because we know that the reason why most Nigerians use facilities that are not licensed and go to healthcare practitioners who are not trained is simply because they do not have access. Because number one, there are not enough of such private hospitals. Recently, the Minister of State for Healthcare in Nigeria this year said that private hospitals, private facilities account for 60% of healthcare provision in Nigeria. 60%. So you don't really have an option in many places of going to a government facility, and those private facilities, only God knows what they do there. And the minister went on to say that he acknowledges that this is the situation and that they are trying now to do something about it, because he suspects that these are the people who are involved with organ harvesting. How do we solve this problem? So number one is there are not enough facilities, and number two, people cannot afford it. So as soon as they're ill, please just call me the chemist. They call the chemist. Chemist, please help me. My mother is ill. We don't have money to pay you. We will pay you later. So those ones are not about to go to a licensed facility, and they're not looking for trained people either. They just need anybody that can deliver them. So except we reform also our health management systems and the ability of other people to gain access to good quality healthcare facilities in Nigeria, then we haven't even begun. And the number of needless deaths will continue unabated in Nigeria. Remember, I am my neighbor, and my neighbor is me. Don't say it hasn't affected you yet, because as I mentioned, both rich and poor have lost people to such facilities before. It's time to do something before somebody close to you dies a needless death. May that not be your portion, in Jesus' name. So we must do something about it. And what can we do? You can start an integrity movement. You can lead an effort to collect information about it. You can join your voice with us to call on the Federal Competition and Consumer Protection Council to team up with well-meaning citizens to do something about these private facilities that are carrying on without any kind of supervision. We know that private medical practitioners and hospitals, they have an association. Let's call on this association to actually come forward and work with the Ministry of Health and work also with the FCCPC and fashion out standard operating procedures that will help ordinary Nigerians tell the difference between quacks and real private practitioners. Then where they find people who are flouting those arrangements, please let's outline what you can do. Who can you report to? And we hope that they will have the power to shut down such places. A few doors from where I am right now, there is one such plastic surgery facility that my staff tell me that even early in the morning, you will see blood running from their garbage outside. So things that should be incinerated are not incinerated. They're put in the general garbage. And the health hazard that is for the rest of us, nobody's talking about that. We really cannot afford this situation to continue. Our mumu don't do. Thank you.